Welcome to Adapt NCLEX, and thank you for deciding to watch this video. Do you know the secret to any NCLEX questions, whether next generation standalone or the generation style of question? Do you know the secret? Right in front of you. Buzzwords, I call it. These are words you recognize. There's no question that would beat you. But buzzwords are your keys to answering any NCLEX question. It guide you to the clue. It lead you to the diagnosis and the management. So let's look for it. Buzzwords for any, no matter how long the case is, there'll be a bunch of distractors on your way to distract you. But as soon as if you continue to look for the buzzwords, you'll be fine. Common case that you already know. I'm trying to trick you. The client presents to the primary care office. Okay, it's not an emergency. 50 years old female. You have to pay attention to age. Probably they'll ask you something about it. Present to the PCM clinic with complaint of what? Sudden onset of what? Sharp. 1. Electric-like. 2. Shooting. 3. Along the left face, jaw, and gum. This is unilateral. This is just telling you unilateral, one side. Pain sometimes described as what? Burning. Another buzzword is intense along the same side. So along the same side of the face. Symptoms comes in what? Clusters. Buzzwords, that means intermittent. And in between those days, patient is fine and lasting for what? Few seconds to a minute. So it's very short. It come in and stop the patient and then it will vanish away in clusters. Report symptoms worse when doing what? Chewing, buzzwords, yawning, and washing the face or brushing the teeth. These are all buzzwords. You should have recognized what I'm talking about right now. If you're not, I'll give you more information. There's no pain with what? Smiling. When you see no, you should not let it go. No tells you you can rule out other problem. It's not this problem. No problem with smiling. When she's laughing, everything look good, and facial expression does not cause pain. These are what we call it review of system. They help you rule out no no's up and no drilling too. So those are your key no's. She recently had similar pain on the back due to what? Herpes zoster. This is a distractor. Put it there to distract you. It's a distractor. He had tried Motrin, acetaminophen, and oxycodone without success. So he's tried other pain medications. It's not helping. That tells you you need something stronger than that. On exams, the face was what? Symmetrical. Good. This is a buzzword to tell you it's not other problem. It's not this problem. It's not, you can use it to rule out other problem. She was able to do what? Close the eyes. Key. Touching of the face, excellent. Elicit the pain. The tongue is midline. This is another key. These three, they related to one particular diagnosis. Tongue midline, closing the eyes, and symmetrical. If she's not able to do this, then it's another diagnosis. But she was able to do this, so you can rule out other diagnoses. The rest of the neurological exams was normal. What are your buzzwords? What are your buzzwords? And what do you think is going on? 50 years old, sudden onset, sharp pain, electrical, shooting along the face, jaw, and the gum. Keywords. Pain, burning, intense. On the same side, you can have unilateral most of the time, 99%, but sometimes you can have bilateral. But most people, 99, you see only one side of the problem. Symptoms comes, clusters, buzzwords. Report symptoms worse when doing what? Chewing, yawning, washing the face, and brushing the teeth. Buzzwords to help you. Smiling, okay, I will underline it. Smiling, laughing, facial expression are normal. Thus, rule out other problem. No drilling is also rule out. Herpes zoster is a distractor. She tried Motrin or Oxycodone telling you she needs something that is good for this problem. On exam, face is symmetrical. We rule out other problem. Able to close the eyes, rule out other problem. Touching of the face, buzzwords. Tongue, rule out. What do you think? The rule out are what? Smiling is good. That means my muscles on my face, when they move, they don't cause any problem. When I laugh, they don't cause problem. When I do facial expression, raise my eyebrows, smile, they don't cause any problem. Okay? And then I can close my eyes. It doesn't elicit the problem. My tongue is midline. It's not moving to one side. This tell you it's not Bell palsy. Bell palsy is what? A motor problem, motor disease. So, and if only few sensory on your tongue, but mostly motor. So a facial expression, laughing, smiling, closing your eyes, your face looks symmetrical. Those are all Bell palsy. So I know this is not Bell palsy. But if I touch the face, wow. If I chew, sensation. If I brush my teeth, yeah. And the pain is what? Sudden electrical shooting along one side of the face. Yes, this is what we call trigeminal neuralgia. And this is cranial nerve 5 problem. This is cranial nerve 5. This is sensory Bell palsy, cranial nerve 7, motor. That's the way you can distinguish between the two. So this lady is having a trigeminal neuralgia attack, jaw, gum, electrical shooting. That's how they would describe it. As soon as you hear it, herpes zoster would do that, shooting pain along the distribution of the issue, but it's not consistent with that. How could I give you so many information about it? I'll give you vesicles. I have to give you vesicles along the face, tell you that he's having herpes zoster reactivation, but there is no vesicles in physical exams. All is happening is when you touch the face, she's having same pain. So this is how you do it. Questions. It's very long. Stay focused. Pay attention to the first 2 lines. They have to pack that place with a lot of to guide you. There's no history that does not have key point in the first 2 lines. This is how patient come when you interview them. They tell you their main chief complaint will be in the first 2 lines. What brought you here? My abdomen, my belly hurt, my toenail hurt. I'm having pain in my face. Then that guide you and the story begin and you dive it and you look for distractors and ignore them and stay focused. You say the first 2 lines as this, therefore it has to be this. I'm looking for something to confirm my diagnosis. So this is what trigeminal neuralgia. What is your treatment? What is your treatment for this problem? Let's do some content quickly. And this question, I can answer any question that I'll provide you every question they can answer you. First of all, they'll ask you, what do you do with this patient? Treatment. The best medication is what? Carbamazepine. And what is this problem? What do you tell them? This can cause agranulocytosis. Therefore, what do you tell them? You watch for their white count. Any urinary symptoms, report that. Otherwise, you get sepsis. Keywords. You see, it looked like what? Clozapine. Clozapine is an antipsychotic. And they will confuse you with that, with pharmacology. It's an antipsychotic, and that also has what? causes agranulocytosis, and that one too. Watch their white count, watch for urinary symptoms, any diarrhea, any nausea, any signs of infection they need to report, and you also check their CBC. So pay attention. Carbamazepine, and Clozapine, they look the same, but carbamazepine is used to do what? Treat trigeminal neuralgia. That's the treatment of choice. Okay, what else do you tell this patient? What do you tell them? You tell them what? To chew on the unaffected side. So chew on the unaffected side. Unaffected side. Use a Bristol toothbrush. Okay. No massaging. Don't massage your face. Don't do that. Okay. Don't touch your face too much because it's causing the pain. Don't eat any hot and cold stuff. That will trigger that. And eat soft diet. And chew on the other side. And this all. And tell them this will go away. It takes some time. Sometimes they will have chronic pain. That doesn't go away. Okay. So their treatment of choice, give them carbamazepine, add Motrin, Tylenol. If they give you select or apply, what medication can you give to this patient? Yeah, carbamazepine. They also need Motrin. They need acetaminophen. They need Invine, SSRI, antidepressant, or amitriptyline, which is a TCA. So they need what we call multimodal pain management. So if they give you a bunch of pain medication, you got to select all of them. If they ask you which one is the treatment of choice, is carbamazepine, which causes agranulocytosis. It's anti-seizure medication. It's used for seizures, but we can use it for this problem. I've given you every content you need about this, and I've ruled out what? Bell palsy for this question. Buzzwords, key knowledge. You see how you can answer any NCLEX question, what? Buzzwords and content, no matter what. You can, I know what they're going to ask you for this particular case. If you get it, this is what they're going to ask you. Management, teaching, education, and then medication, which is a pharmacology, and the side effect, agranulocytosis. And then you treat them with that. If you need any content, just follow Adapt NCLEX. Subscribe for more content like that. And follow your buzzwords that will lead you to the diagnosis, and ignore the noise, which are the distractors. Take care of yourself. Bye-bye.